Hello everyone, welcome back to Metacraft. If you're new here, make sure to hit that subscribe button because we're making community medicine easy and engaging. Today's topic, some super important concepts in public health. Things like community diagnosis, health technology, integrated health services, and more. So grab your notes and let's jump right in. Let's start with community diagnosis. And no, it's not diagnosing a disease like a doctor would for a patient. It's actually the identification and measurement of health problems in a community. We use things like mortality and morbidity rates to figure out who is at risk, who needs healthcare the most. For example, if a town has high infant mortality rates, public health teams will focus on improving maternal and child health care. Makes sense, right? Next up, health technology. This is all about applying science and technology to improve healthcare. It includes both manpower, doctors, nurses, health workers, equipment and tools like CT scans, MRIs, and ECGs. A simple yet powerful example, oral rehydration salts, ORS. Something as basic as ORS can save a child's life during diarrhea. Just imagine the impact of advanced technologies. Alright, imagine a one-stop shop for healthcare. That's what integrated health services are. It means combining preventive and curative services under one roof. For example, a family planning clinic that also provides child immunization. A primary healthcare center offering both disease prevention and treatment. This approach saves time, money, and resources while improving health outcomes. Win-win, right? Here's an interesting one. Social anatomy. Ever wondered what makes up a community? It's not just the people, but also their culture, economy, and environment. By studying this, public health experts can figure out how diseases spread in different social settings, what health interventions will work best for a specific community. Think of it as a health map of a community. Now let's talk about healthcare services. This includes everything related to personal healthcare, health education, medical research. Its main goal? Protecting and promoting health in a community. So whether it's treating a disease, educating people, or conducting research, it's all part of healthcare services. Okay, let's clear up a common confusion. What's the difference between an objective, target, and goal? Imagine a cricket match between India and Pakistan. Goal: Pakistan wants to win the match. Target: they need 201 runs to win. Objective: each batsman's job is to score as many runs as possible to reach the target. See the difference? Objective is the steps we take. Target equals a specific milestone. Goal equals the ultimate achievement. Simple, right? And that's it for today's lecture on community diagnosis, health technology, and more. We covered some super important concepts that form the foundation of public health. Don't forget to subscribe for more videos like this. And as always, stay curious, stay healthy, and I'll catch you in the next one. Bye for now.